Sickle cell disease, SCD, is an autosomal recessive trait prevalent primarily among African American, Southeast Asian, and Middle Eastern individuals, affecting approximately 1 million people worldwide. In African American populations, it manifests in 1 out of every 365 births, while in Hispanic American births, the occurrence is approximately 1 in every 16,300. Diagnosis typically involves newborn screening, genetic testing, sickle turbidity test, and hemoglobin electrophoresis. Hemoglobin development progresses from conception to 42 weeks of life. During fetal development, primarily fetal hemoglobin, HGBF, is present, characterized by larger size, resulting in increased mean corpuscular volume (MCV) and higher affinity for oxygen. Between 36 weeks gestation and 6 months of age, there is an increasing production of adult hemoglobin, HGBA, with HGBF constituting approximately 65–95% in newborns and primarily transitioning to HGBA by 6 months of age. Fetal hemoglobin, HGBF, does not sickle. Sickled cells clump, blood become more viscous, no blood flow result in vaso-occlusive process. Vaso-occlusive process. Hemoglobin S, HGBS, arises from the substitution of a single amino acid, glutamine, valine. Unlike the typical 90–120-day lifespan of HGBA, HGBS has a shorter lifespan of around 15 days, leading to increased reticulocyte count. Under conditions of stress or trauma such as infection, fever, acidosis, dehydration, physical exertion, excessive cold exposure, or hypoxia, HGBS polymerizes, forming characteristic sickled cells that are sticky and inflexible. This polymerization leads to intravascular hemolytic anemia, causing occlusion of microcirculation, ischemia, and subsequent chronic organ damage. Or in simpler terms, hemoglobin S, HGBS, is a type of protein in our blood that is different from the usual type, called HGBA. It's caused by a tiny change in its structure, making it more fragile. While HGBA can live for about 3 to 4 months, HGBS lasts only about 2 weeks. When the body undergoes stress or injury like infections or lack of oxygen, the HGBS molecules can stick together, forming sickle-shaped cells. These cells are sticky and stiff, which can block tiny blood vessels, causing problems like anemia, not enough healthy red blood cells, pain, and damage to organs over time. Vaso-occlusive crisis, VOC, occurs when triggers, such as the presence of hemoglobin S, HGBS, cause red blood cells, RBCs, to transform from pliable discs to rigid crescent or sickle-shaped cells.